Welcome to this presentation from that green pen. In this video, we will discuss about smoking cessation. Smoking remains the leading cause of preventable illness and early death. Let's explore how pharmacists can support smoking cessation effectively. Smoking tobacco is strongly linked to lung cancer, chronic obstructive pulmonary disease, cardiovascular disease, and pregnancy-related complications. The benefits of stopping smoking begin right away and reduce the risk of worsening or developing smoking-related illness. Nicotine withdrawal can make quitting difficult, leading to cravings, irritability, restlessness, poor concentration, and changes in sleep or appetite. The most effective approach is quitting in one step, supported by drug treatment and behavioural support. For those not ready, harm reduction and specialist referrals can help. Pharmacists play a key role in providing counselling, helping patients set quit dates, and offering follow-up support to improve long-term success. Treatment options include NRT, nicotine receptor partial agonists such as varenicline or cetirizine, and bupropion, all most effective with behavioural support. E-cigarettes are substantially less harmful than tobacco and may help people quit. However, long-term safety remains under investigation. Pregnant women should be advised to quit completely. If needed, nicotine replacement therapy is safer than smoking and should be combined with ongoing support. Pharmacists are central in smoking cessation. By offering drug treatment, counselling, and follow-up care, we help patients achieve long-term success. If you found this valuable, like, share, and subscribe for more insights on pharmacy and healthcare.